Alrighty, and welcome back. This should be the final video of the Physiology and Pathologies series, I guess you could call it now at this point, since it's been 3 videos. So we last left off with I believe it was the integumentary system pathologies. And so let's go ahead and go. Go ahead and look at the nervous system. All right, so first and foremost, this system is very complicated, but we only look at it in a very simplified sense, which is we have information coming in and responses going out, basically. And the biggest part that we should really pay attention to as massage therapists in this lecture is the sympathetic versus parasympathetic systems, right? So first off, the nervous system, in its basic sense, receives sensory input, right? So we have a lot of specialized receptors out there that detect all these certain things in the outside and internal environment. And then we're going to take that sensory input, bring it towards the central nervous system, and then interpret that. So basically, we're getting a message. We're getting some sort of letter in the mail, email, whatever you want to call it. We're sending it to headquarters, literally headquarters. Not always, but sometimes the responses can be processed right at the level of the spine. But anyways, we're going to interpret that signal that is now coming into the central part of the nervous system. And then based off of the information, we're going to cause a motor output or a motor change. In the easiest example or easiest way to summarize this is you brush up against maybe like a hot stove, right? So immediately there's receptors on the body in the skin and everything that are registering heat, temperature, pain, tissue damage, all that stuff, right? And we're going to send all that signal, all that information towards the central nervous system. We're going to interpret that this stove is hot and we're damaging our tissues, and we're going to send a signal back out to say, hey, all these little muscles and everything, go ahead and move the arm backwards and get us as far away from that heat as possible. So, of course, that's not the only responsibilities of the central nervous system. Of course, we do have higher cognitive functions, right? It's involved with the memory process, learning process, emotional responses, right? Our limbic system is quite complex and regarding the instinctual behaviors, emotional behaviors, and so on and so forth. So again, we're only paying attention to the basic relay system, the electrical relay system of the nervous system itself. And so before we go any further, again, I just want to put a note about the sympathetic versus parasympathetic systems. Remember, our peripheral nervous system, which is the nerves that are outside the central nervous system, which include the cranial nerves and the spinal nerves, those nerves are subdivided into two major groups. We either have the somatic division, which governs, motor output and sensory perception. And then we have the autonomic nervous system, which regulates bodily functions and organ activity and stuff like that. And so of the autonomic nervous system, we break that down into the sympathetic division of the nervous system, autonomic nervous system, and the parasympathetic. So the sympathetic, remember, is our fight or flight response. I think most people know that. And our parasympathetic is the rest and digest, as we often call it, sometimes feed and breed. And knowing what's happening during the engagement of those two systems is really important for massage therapists, right? Because more than likely, our clients are going to be relatively sympathetic in a nutshell, right? And so we want to take them from this nervous state, this anxiety-ridden state, whatever, and move them towards the parasympathetic state, which the parasympathetic state, rest and digest, feed and breed, well, kind of hints towards what's happening, right? So our breathing rate's going to slow down, our heart rate's going to slow down, our muscles are going to relax and not be as toned and on guard, or as we call muscle guarding, as you would see in the sympathetic division. Our digestive motility increases, our, urine production increases, and we'll pee frequently, right? I mean, think how common it is that your client gets off the table, it's like, oh, I got to go to the bathroom, right? Well, signs of a good job that you more than likely have activated the parasympathetic nervous system and got that client nice and relaxed. So, again, put a big emphasis onto that. Make sure you go back and study that. Let's go ahead and look at some of the pathologies of this system. Our first pathology up is Alzheimer's. So, of course, all of these pathologies we're going to be looking at are either cognitive or neurodegenerative or neuropathic complications. So Alzheimer's, right? We're probably all relatively familiar with the situation, right? We've probably had an elderly, loved one that maybe had developed Alzheimer's, and so we all associate that with, memory loss and forgetfulness and all these other things. And so, more specifically, Alzheimer's does lead to deterioration of the brain, and to the point where there's different stages, and eventually you would even forget to breathe, and that would eventually kill you. So Alzheimer's isn't specifically received or infects or affects, there we go, the elderly. Any particular person could potentially get Alzheimer's. So there's a lot of potential causes for Alzheimer's. Some people even say that like a lot of stressful events can cause or onset Alzheimer's. But regardless, so what are we going to do for someone with Alzheimer's? Well, one depends on the level of severity, right? So of course, our general summation of forgetfulness is a big thing, right? But there's some other things we'll need to consider as well, along with Alzheimer's. So if they're relatively cognizant and can function on their own, then the few major considerations would be your timing and everything, and making sure that if they are in a later stage of Alzheimer's, that they might have a caretaker or someone to basically consent for them. But a big thing sometimes with Alzheimer's is what we call daylighting, I think it's called, where typically in the morning, early in the morning, they're more cognizant, more aware. And then as the day progresses into the evening, they become more forgetful, and the symptoms start to really show. So typically booking your clients with Alzheimer's or memory loss like this is usually best done in the morning, right? And the biggest key thing with Alzheimer's is just consistency. Anytime that you have someone who has memory loss and forgetfulness like this, especially when they have, special units in, the hospice environments and so on and so forth, right? The biggest thing they promote is consistency, making sure that the schedule is the same, everything's pretty much exactly the same. That way it can build a routine as best as possible. Sundowners, thank you, is what the term was called. So consistency is going to be your biggest thing, right? So, maybe sticking to the same time, same day, same frequency of appointments, right? Also consider too, should they happen to forget you on the table or, have that sort of lapse of memory, oftentimes it's sort of best to just go along with the stories. Sometimes it's quite a fascinating thing. They'll start merging different parts of their lives. They might revert back to when they were like 10 years old. So sometimes, just going along with the story is good. And if they become, really agitated or anything, then, stop the massage. Hopefully if they're at that point, they might have someone who's watching over them, watching for them out in the lobby, and you can get them to come in and help. Otherwise, just stop the massage until they've, calmed down, and just, try to keep them in a relaxed state, in the sense of, if they're freaking out because they don't know where they are or anything like that, just try to do your best to, maintain their sense of ease of mind. But I think that's pretty much all to really consider about Alzheimer's. Of course, you would also consider making sure that you had consent for the individual to receive massage, especially if they had a caretaker as well, if that wasn't already a given thing. Attention deficit hyperactivity disorder, ADHD, right? We all have it. Well, squirrel, right? So more specifically, of course, this relates to people whose attention just is easily spatiated. You just, kind of are distracted in a sense, right? And so what do you do, right? For someone who might just be uncomfortable sitting for long periods of time, become easily distracted or anything like that, well, some of the easier things to consider about your massage is, keeping your appointments shorter than normal, right? So maybe you only book 30-minute, sessions, hours sessions. Maybe you try to make sure that you keep their attention with the massage, instead of being so relaxed, incorporate a little bit more of a stimulatory type of massage in some senses, to essentially, keep their attention and activity and mental activity. Communication can also be a way to do that as well. Just making sure that your communication doesn't distract them even further to the point where they become restless on the table and they're just, so excited about the conversation or anything else around that now they, can't relax on the table, can't sit for long on the table. But pretty much, other than that, there's not much to really consider about ADHD for your massage considerations. Autism. So autism is a cognitive disorder where, even though most people with autism are actually quite smart in many regards and, can do certain things really well, but on the whole, we consider them to not have as much cognizance around normal social activities, social behaviors, and things like that. So if someone is autistic to the point where they do have cognitive defects, then they more than likely have a caretaker. And that, of course, anytime that someone has a caretaker or isn't considered able to consent for themselves, we always want to make sure that someone is there to consent for their care. So with autism too, what do we do with massage? Well, they're normal people, right? They're just a little socially awkward, I guess you could say, if that's, not a bad term. So, treating them just like normal people is perfectly fine. And the way that you interact with the person just is like a normal person, though you do want to consider that they might be a little less receptive in certain regards, especially some might be a little awkward about the touch, about receiving touch. There's some might be awkward about certain positions. Some might have, certain tics about, being touched certain ways. Like, so, ever seen the movie Something About Mary, where he had the, thing about his ears, those do exist. So making sure that you have the communication between both the patient, the client, as well as the caretaker, to know, just how to, make this individual more comfortable is a big thing. So another thing is, the therapeutic relationship always exists with any client, especially with our autistic clients. And so we want to make sure that we're building that rapport and building that respect with this client, even more so. And so it might take a little bit longer than average. And then another big thing about that too is consistency, right? So sometimes they're not very receptive of change either. They like to have their routines. If someone's not there normally that they normally see, it can kind of throw their schedules off, and it kind of creates a little added agitation in some regards. But otherwise, just making sure that they're comfortable, making sure that you have consent, and just making sure that you're, considering their what's the word I'm looking for? Their particular boundaries as you would for any regular person. Let's see, anything else about autism? No, we've had several autistic people both in the clinic that I used to work at and the gym that I used to work at. They're really smart, and don't let them try to fool you. Sometimes they might play off like they don't know certain things, and they might act a fool. Sometimes you got to be a little assertive with them, like to try not to let them get away with things in a sense, because they try to take advantage of it. But yeah, otherwise, just normal people. Bell's palsy. Bell's palsy here is what looks like a stroke, but it's not a stroke. So we call this partial facial paralysis, and its onset is idiopathic. Idiopathic means that it could have no known cause. Some people literally just wake up like this, or throughout the day, all of a sudden, someone's like, "Hey, why is your face all droopy?" And they're like, "What?" It just happens, and we have no necessary reason why. Of course, there might be some instances, sure, if you had head trauma or something like that, then yeah, we could probably associate that maybe that was one of the possible reasons. But anyways, so weakness to the muscles due to some sort of restriction or obstruction or whatever of the facial nerve leads to that droopy face. And there's really no concern for massage therapy. Technically there's no damage as long as they had never had an injury or anything like that. Bell's palsy typically will correct itself over time, but I have seen some research about massage therapy to suggest that facial cupping can help with stimulating the nerve supply to those muscles, and I would assume that any massage would too. This particular study I saw was about facial cupping, but stimulation of the muscles and getting those receptors activated and getting signals sent through that nerve pathway may be beneficial in Bell's palsy's case. Carpal tunnel syndrome. So biggest thing to know about carpal tunnel syndrome, we all pretty much know what carpal tunnel syndrome entails, right? The pressure around the wrist, pain in the hand and fingers, and this, that, and the other, right? And we always associated to typing or doing things with the hands and so on and so forth. One of the biggest things to know about carpal tunnel syndrome, though, is which nerve is affected. So first off, just taking a brief look over the anatomy, the carpal tunnel is formed by your wrist bones. So your wrist bones form a little U, kind of like this. And your tendons, your nerves, blood supply, all that runs through the area and is covered by a band of tissue. So what happens? Well, pressure builds up in the area, most commonly because of, one, the position. So like guitarists, guitar players can receive carpal tunnel. People who use the wrist a lot can receive carpal tunnel. So using the wrist a lot in general can create, inflammatory markers in the area, which then creates, pressure and swelling in the carpal tunnel, which then presses on this particular nerve. I'll get to that nerve. Or even typing, right? Because the tendons of the hand run through there. And so imagine you taking the tendon being a string and you just back and forth like that, right? That's going to create a lot of, inflammatory markers as well. And so this pressure builds up in the carpal tunnel and then compresses on the median nerve, right? So think that it runs in the middle. So therefore, it's the median nerve. Median, like the median of a highway, it's in the middle between the lanes, right? And it just gets compressed, which then causes the pain, irritation, numbness, tingling sensations, paresthesia, as we call it, which is a general term for pain, numbness, tingling, prickling, burning, pins and needles, numbness sensations that you would feel. So carpal tunnel, what do we do? Well, one, carpal tunnel syndrome is an overuse injury, right? The reason we develop carpal tunnel syndrome is because we're doing so much work and activity with our hands and our fingers and our wrists and whatever, right? So first and foremost, stop what you're doing. Take a vacation from using your hand and wrists and everything. I know it's easier said than done, but just allowing time to just relax the area out is going to be a good thing. The next thing you could do is also ice massage, especially if you wanted to incorporate that. But just if, let's say you had carpal tunnel yourself, just doing a little ice bath up to the elbow would be quite beneficial as well. And then especially with the ice bath, you get that hand cold and then you just slowly move and do like a cryo stretch for the hand and wrist as well. And I say this now because, well, who's also in line for carpal tunnel, if not massage therapists, right? So make sure you take care of your hands and wrists, right? Sometimes you want to ice them. And then, massage therapy is a shining star in the realm of carpal tunnel syndrome. So what do we do? What do we focus on? Well, pretty much all of your forearm muscles. Of course, our go-to muscles would be the flexor muscles being on the anterior side of the forearm. Of course, we'd want to work those muscles, but don't leave out the extensor muscles as well, because especially if your hands are cocked back typing, those extensor muscles can lead to the positioning of the wrist as well. And so don't rule it out. Just a good general massage as well onto the forearms can do wonders for carpal tunnel. Double crush syndrome. So double crush syndrome is a form of radiculopathy, which is radiculopathy is where we have a pinched nerve, basically. So double crush syndrome is, well, that happens at 2 points. Get it? It's crushed double times. So especially long nerves, in this case, the image depicts someone's nerve from the brachial plexus. Looks like, okay, so yes, it's even the median nerve right there. And so more than likely compressed around either, could be under the clavicular area, subclavicular area, could be compressed or impinged at the nerve root itself. So that could be a double impingement, maybe even have an impingement somewhere else. Well, shoot, maybe even an impingement at the wrist just from the previous carpal tunnel, right? That could be your double crush. So anytime that you have nerve impingement or radiculopathy, well, one, you would have pain, numbness, tingling, prickling, burning, pins and needles sensations, the paresthesia, as we just previously mentioned. And there are essentially two types of nerve impingements, right? We have soft tissue impingements and we have hard tissue impingements. It should be self-explanatory at that point. Soft tissue is pretty much anything that's not bone, and then hard tissue is bone. So, of course, if it's a hard tissue impingement, massage therapy can't do a whole lot. That's going to be more into your chiropractic realm, into readjusting where the bones are positioned or positioning them off of the nerve itself, which, not to say that chiropractic work and realignment wouldn't require massage as an assistance, but massage by itself would not be completely beneficial. Now, soft tissue impingement, absolutely, right? Because massage therapists, right, that's our bread and butter, the soft tissues. So, of course, consider how nerves move, or not necessarily move, but the way that they run, right? They all start from the spine, and then they radiate outwards and around, right? So if they're having pain, numbness, or tingling somewhere in the arm, right? Track that pain all the way up to the nerve root. Maybe you'll find that there could be some muscle tension here in the neck compressing right there at the nerve root itself, which then is causing the pain to radiate into the arm. And so you're over here working their forearm because that's where they're feeling the pain. But as massage therapists, I always say, don't be symptom chasers. Find the solution or find the problem, go to the source, right? So pain more than often is the symptom, where the source of the pain or the problem is somewhere else, right? So in this case of of radiculopathy or of pinched nerve, then your source is, well, the impingement, and so they might feel the pain anywhere along the pathway of that impingement. So, you know, don't be a symptom chaser, be a problem solver, go to the source. Herniated or bulging discs. Do not call them slip discs. Discs don't slip. There ain't no banana peels in your body that they're going to slip on. They're herniated discs. They are bulging discs. So we've all heard of them. We all kind of have an idea about them. But let's put a little bit of anatomy into it. So first off, what are we talking about? Well, we're talking about the discs that are in between the vertebrae of the spine, more specifically the bodies of the vertebrae, right? Because remember, we have that big solid body like this and another big solid body, and then there's a little cushion in between. That cushion in between is the disc. And the disc consists of two major regions. We have the inner region, which is typically a little bit softer. And I'm told the example of a jelly donut isn't the best example, but whatever. Think like the center is really soft, like the jelly of a jelly donut. And then we have the outer ring that is a lot harder. We'll say that's like the bread of the jelly donut. So the inner region, the nucleus pulposus, is soft. And so weakness in the outer ring, also known as the annular fibrosis, causes this inner fluid, inner gel to push into the outer ring, which then pushes it out, bulges out. We all can understand the definition of bulge, that it's just pushing outward and you know, creating this nodule, this, you know, palpable nodule, this big old. So imagine if it's supposed to be flat like this, and then boop, you have this thing poking out, right? It's bulging out. So herniated bulging discs can be caused, of course, because of, you know, immediate trauma. You know, so, you know, a lot of pressure on the spine can then, you know, cause the weakness. I mean, just general weakness of the outer ring itself can cause the bulge, so on and so forth. So what do we do? Well, one, a lot of bulging discs, I've seen a lot of science on bulging discs that the vast majority of bulging discs are asymptomatic. Matter of fact, it's common that people have them and never even know until they get checked out for some other problem. Like, oh, well, yeah, that disc is bulging. So sometimes it's not even a problem, nothing to even worry about. But also, one, I've seen a lot of science too that says that herniated or bulging discs can correct themselves on their own and don't always often require surgery, but sometimes they may. And then the biggest problem with the herniated or bulging disc is that it could potentially compress a nerve, which then would cause that previous radiculopathy, you know, a nerve entrapment, nerve impingement, right? And so that's one of our biggest concerns, right? Is that it's pressing on the nerve, causing the pain and discomfort and everything. Now, what do we do as massage therapists? Well, one, if they do have a herniated or bulging disc, well, we should probably, if it's really severe too, you should probably have some sort of clearance from anyone that they're seeing currently for treatment or whatever regarding the herniated disc. Also consider that your stretching may not be one of the best things that you want to do. So how to think about stretching and the movement of the vertebral column in regards to a herniated disc. So let's say this is your disc, right? And your disc is bulging out this way. Well, when your spine moves, it will compress in the direction that you're moving, right? So if this is my disc and I'm bending forward, I'm going to put pressure on the very front part of the disc. If I bend to the side, I'm going to put pressure on this side. And if I bend to this side, I put pressure, and so on and so forth, right? So basically, the position and the way the spine's moving would cause pressure on various different parts of the disc. So theoretically, if let's say the disc is bulging to the left, if I bend the spine to the left, it could cause compression or extra pressure around or on that bulge itself, which then could cause pain or, even bigger problems. So, considering the movement of the spine itself is a big thing, considering spinal column movements, flexion, extension, anything like that, lateral flexion as well, is one of your big concerns. Also consider how they might be able to lay on the table. Some people could be very debilitated because of herniated bulging discs. So bolstering and cushioning your client is also a big thing to consider as well. I know we've talked about that in the other video with other conditions, right? And how the spine, adjusts to the bolstering. So make sure you go back and check that out. But what sort of activities are usually good for a bulging disc? Well, typically traction. So traction is usually pretty good. I mean, and theoretically, right, if the disc is compressed and bulging because of that, then decompression, also known as traction, would help alleviate that symptom. So sometimes maybe a little traction. Now, of course, we're not in the scope of practice to be curative or try to treat it, but traction might be a beneficial thing. So tractioning of the legs or anything like that might relieve a little bit of discomfort, with a disclaimer that know what you're doing first. Bulging discs. Migraine headaches. So migraine headaches, right? Two major types of headaches we talk about, right? Migraines versus tension headaches, right? I think we already talked about tension headaches previously in the first video in the muscular system. Remember, tension headaches caused by muscular tension, right? And anytime there's muscular tension, massage therapy comes in. Migraine headaches, though, are quite the opposite. Migraine headaches are typically caused because of lots of other things. So sometimes they can be hereditary. Some people just have a predisposition to get migraine headaches. And a lot of people who have chronic migraine headaches, they usually have a neurologist they see, they usually have a medication they take, and so on and so forth. But migraine headaches can be caused because of light sensitivity. They could be caused because of stress. They could be caused because of nutrient deficiency. They could be caused by hormonal imbalance. They could be caused by a whole bunch of things that massage can't really help too much with, right? So massage for migraine headaches is more palliative. It's not to say that we won't make them feel better, and that making them feel better might actually get rid of the headache to a certain degree, but it's never going to be solved by massage itself, right? So whenever it comes to anybody with a headache, pretty much any massage in the upper body, neck, shoulder, face, scalp area is going to be your best bet. And then if they're having a whole bunch of discomfort with their migraine headache to the point where, they're like gonna vomit or something like that, maybe just ease up on your massage, stop the massage, postpone the massage if absolutely necessary. Multiple sclerosis. So acronymed MS, multiple sclerosis, is a autoimmune disorder where your immune system, right? So first off, autoimmune disorders, right, is where your immune system, I think we already mentioned this last week, your immune system attacks normal healthy tissue that should be there. In this case, your immune system is attacking the myelin coatings produced by the oligodendrocytes in the brain. So what happens is this myelin sheath, this myelin coating, which helps the conductivity of the nerves, starts to become destroyed. Now nerves aren't conducting as well. So basically what this causes is what they call lesions in the brain itself. So essentially think like a big scar, a big cut, a big whatever rip, tear in the brain itself. And so I used to teach massage, or not massage, I used to teach yoga for people with multiple sclerosis. And so my sister-in-law also has MS. One, it can go a long time before it's detectable. And typically what causes you to detect it is where something odd happens with your nervous system. So some people, they just kind of like lose balance and fall out, and then it's just like a weird thing. They get checked out and then they find the lesions. My sister-in-law in particular, she went blind in one eye for like a week or two, and turns out they found that she had multiple sclerosis. So multiple sclerosis leads to a great severity if not untreated, or progresses very aggressively to the point where they could be wheelchair bound, and eventually kills the individual as well. So multiple sclerosis affecting the brain, a few considerations of one, we would always keep our yoga studio cold whenever we did the multiple sclerosis class, because you think like, well, your brain's like a computer, and so if your brain's heating up and it's active, right, you want it to be cold. Now, granted, I've had a few students who were like, I hate the cold, but theoretically, and some of the science shows that a colder environment is typically better for MS. So if you have the ability to keep your room a little bit colder than normal, maybe consider that. But that's still up to the client's preference. Other things too, well, like I mentioned, that they could be ambulatory, right? That's a big thing too. So consider your environment of massage, right? Do you have throw rugs? Do you have obstacles that could trip them up, and so on and so forth, right? So that's a big thing to consider, making sure that, again, with any client in any facility, make sure your facility is barrier and obstruction free so that they can't trip or fall over anything. But another big thing too is that they can change day to day. So I've had students who they come to the yoga class, and some days they had to be wheeled in by, in this particular case, it was her husband. She had to be wheeled in. And then some days she walked in by herself. So different days can really change for someone with MS as well. So just being mindful of, your environment and how you work on the client, and making sure that they can get onto and off of the table safely as well. Another thing too is that there are lots of different types of treatments for MS, and one treatment for one person that works will not work for another person. Some people take medications orally. Some people actually have to have infusions. So whenever you're dealing with medications like that, infusion medications or stuff like that, that is another consideration as well. If they recently had their infusion, say that morning, typically they're not drained or anything as much, but circulation of the body, especially around the injection site, around the where the infusion is. Some people actually might even get a port for this if it's really that long, but considering a port as well, working around a port, just being very careful and typically avoid the area as best as possible as well. But MS, pretty interesting condition. Parkinson's. So Parkinson's is a neurodegenerative disorder where part of the brain is basically degrading and causes the tremors and ataxia, essentially. Ataxia being a poor gait pattern, especially through a neurological means. And so it just progresses eventually pretty far, where speech is affected, just absolute motor coordination is affected, and so on and so forth. So basically, same kind of thing goes along, like we were just mentioning for MS. Anytime you have someone who is a mobility challenged or anything like that, making sure that your facilities are barrier free, making sure there's clear pathways, clear walkways is an absolute must. Especially, sometimes Parkinson's, people with Parkinson's, they can barely lift their foot off the ground. They shuffle. So, that's a big thing to consider as well. And, of course, making sure they can get onto and off of the table as well. Sciatica. So sciatica, right? We all hear it's like, oh, my sciatica. Oh, my butt hurts. It's sciatica. Oh, my leg hurts. It's sciatica. Oh, I'm sciatica, right? It's ruining my life. Sciatica is causing the national debt, whatever. So sciatica is essentially pain that you would feel in the leg, lower back, all the way in that area because of, well, the sciatic nerve. Something's going on with the sciatic nerve. So there's a few forms of sciatica. Of course, we could have, that essential radiculopathy, actual impingement of the sciatic nerve, where common places of impingement would be at the base level where it comes from, at the spinal root. It could also be impinged where it passes through the sciatic notch of the pelvis itself. So there could be a hard tissue impingement, right? There could be so on and so forth, right? There could be soft tissue impingement. And one of the biggest muscles associated to soft tissue impingement of sciatica, or the sciatic nerve, is the piriformis. And I know you're going to talk to a bunch of therapists out there, especially once you get licensed in the clinic and you're like, oh, I'm piriformis sciatica. Oh my God, I got to work it. I'm tired of hearing people talking about piriformis and sciatica and giving piriformis a bad rep, especially massage therapists who, anytime someone's got sciatic pain or sciatic pain symptoms, they just want to press in and beat the crap out of piriformis. Piriformis ain't do nothing. I mean, it probably is the cause, but the reason behind it being the cause, it didn't do anything, right? It didn't deserve a massage therapist just straight punch piriformis in the face. So why would someone have sciatica because of piriformis? Well, one, the sciatic nerve runs right behind piriformis. And so when piriformis gets tight or stretched out in this case, it presses onto the sciatic nerve. But why is piriformis doing that? Well, the piriformis itself is elongated when you're sitting down. And the most common times people have sciatic problems is because they're desk ridden. And so the piriformis actually becomes weak, elongated, which then eventually presses on and irritates the sciatic nerve. So what you should actually do for piriformis is strengthen it, not relax it with massage. And so all these people are, piriformis, blah, 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 blah. I just want to slap them in the face because they really don't know what's going on. Matter of fact, any physical therapy that you're going to do for sciatica is strengthening the posterior parts of the body, especially piriformis, the gluteal muscles, strengthening the low back, all of those muscles in the area of the sciatic nerve, because they're weak or stretched out and causing irritation. Do some squats, do some Supermans, strengthen that booty. Get that peach going, I think, right? What you ladies call it a little peach, right? The peach emoji, something like that. I don't know, it might be something else, something dirtier. Sorry, cancel me, whatever. But anyways, yeah, so anytime you're dealing with the piriformis, consider what I said. Don't give piriformis such a bad rep. It's not his fault. It's sitting, that's the fault. Strengthen it up. Seizures. So, seizures are episodes of overactive brain activity, right? Where it can cause loss of consciousness, it can cause spasms, it can cause convulsions, all that scary stuff. So of course, the biggest condition people see around seizures is epilepsy. If you're an epileptic, then you are more than likely prone to having frequent or reoccurring seizures. And there are lots of different types of seizures, ranging from just something small little seizures that literally happen that honestly the regular person wouldn't even recognize something happened. They just kind of see the person pause or something, and then they're just like, the person's like, oh, well, whatever, towards, your grand mal seizures where you're having, convulsions and you're on the floor, you lose consciousness, crazy stuff, right? So, one, seizures can be triggered by, too much neural activity, too much stimuli, right? Especially in the form of lights or other sensory perceptions, especially in abundance. So I guess make sure you don't have a laser light show concert in your massage room, whatever, right? But sometimes even the change from a dark massage room to a very bright hallway could be enough to trigger it. So consider that, right, to grade your light a little bit higher than normal. Maybe you don't want to keep your massage room so dark, especially if like your lobby is just like bathed in sunlight afterwards. That's something to think about. But what happens if someone has a seizure? Well, pretty much this go-to list here is pretty perfect. So one, try not to freak out. I mean, in any emergency situation, don't panic, right? And then, of course, don't crowd around the person. You're like, in the sense of like, think like a public space, right? If someone just falls out and everyone's like hovered over the person, that's just not conducive, right? Protect from injuries. So especially if they are convulsing, then then they're thrashing their head, then try to get a pillow or a cushion to place under the head so that they don't smack or hurt themselves in any way, especially if they're still standing and you have the ability to, don't break your back to try to catch them, but if they're still standing, try to help them, get to the floor without hitting anything on the way down, because that happens too, where someone will fall out and they'll hit a desk or a table or whatever, right? And then the injury that they got because of that was worse than the seizure. But anyways, if they do have it like a necktie, if they're a business person or anything, jewelry around the neck, and it becomes obstructive, make sure you loosen that out. So okay, put something under the head. That goes with protect from injury in my case, but whatever. Let's see. So make sure that you prevent them from choking on anything. So turning them to the side or anything like that, especially when they start like foaming or anything. I know some people say they like swallow their tongue. That's not true. That doesn't happen. But try not to like reach into their mouth to move their tongue or anything like that. Maybe if they were chewing gum too, especially turn their head to the side, but don't try to go in their mouth to take it out. And then should they happen to start choking on that, do some chest compressions, Heimlich maneuver, whatever. I know that says never restrain, but it's a touchy subject. If they are very violent with their hands to the point where they're causing damage, then lightly restraining the client's hands is going to be a good thing, right? If they start just clawing at their face or reaching out and just thrashing around very violently, or just really convulsing very violently, that like even the pillow you put under their head, if you have to, stop them from hurting themselves, but don't restrain them to the point where they can get hurt because of being restrained. So after the convulsions have stopped, they more than likely will be passed out, but you should definitely start a timer, even as soon as, I know it's going to be less in your mind of starting a timer, right? When they start convulsing, you're going to be panicking more than likely, but don't do that, right? Step one. But make sure you start timing it, right? So especially once they stop convulsing, then you can start your timer and just think to add maybe like 30 seconds to that time. If the time of unconsciousness exceeds more than 4 or 5 minutes, that's when you want to call a medical response team. You want to call EMTs out to the scene. But immediately you might not want to I mean, I guess it's just company policy, right? Call the paramedics anyways, but typically they'll wake up and they'll just be like, oh, why is everyone staring at me, right? They won't even know that it necessarily happened. And so in this case, the last option here says offer the support and allow them to just rest and relax, and just give them time to recuperate before they go about their day. So yeah, seizures, don't be scared, it could happen. We had someone have a seizure in our clinic one time. Interesting. Thoracic outlet syndrome. I know, oh, this is a big one, right? It's on all those tests. Anyone who's taken the final, right, has seen this one for sure, definitely, right? So first off, what is the thoracic outlet? The thoracic outlet is the space between the collarbone and the first rib. And so your blood vessels and your nerves pass through this area, right? Which includes parts of the brachial plexus, includes the subclavian artery and vein, right? So in a nutshell, there's compression of those neurovascular structures, which then causes pain, numbness, tingling, paresthesia sensations, right? Here's that paresthesia again, into, well, the affected arm, because that's more than likely the pathway that these structures are taking. So thoracic outlet syndrome could be caused because of trauma, right? Automotive accidents. It could be caused by, just posture, position. It could be caused because of the skeletal frame that you have, so on and so forth, right? But in many cases, massage therapy might actually be helpful with thoracic outlet syndrome. And so as you can see, especially in this picture, right, what's the muscles that you might even consider working? Well, those anterior scalenes, or well, the scalenes in general, right? So because your first and second, well, excuse me, not first and second, but your anterior and middle scalenes attach to the first rib, right? And so your scalenes will lift that rib, which then could cause that pressure or compression of those neurovascular structures. So working on those scalenes is the go-to muscle for sure. There's other forms of physical therapy that you could perform as well. Muscle energy techniques which are in our scope of practice can also be utilized as well. So you're like PNF stretching and everything to again target more specifically those scalene muscles, right, are a go-to thing. So yeah, thoracic outlet syndrome, typically an overuse injury as well. Please make sure you just try to remember this one. I know this, I don't want to sell my tests out, sell them out short, but thoracic outlet syndrome is on quite a few of them. Trigeminal neuralgia. So first off, we have neuralgia, which if we break that word down, algia means pain, neuro, well, nerve pain. Trigeminal just happens to be what's called the fifth cranial nerve. So the trigeminal nerve receives sensations from pretty much just like all of the face almost. And so trigeminal neuralgia is pain received in and felt around the entire face. It could most commonly around the jaw, but it could be all the way up here as well, towards the eyes and brow. Trigeminal neuralgia, quite a few onsets. It could be an infection, could be actual trauma, so on and so forth, whatever, right? Massage itself won't really do anything for trigeminal neuralgia. So our only biggest concern is making sure that the client is comfortable and that they don't, get any painful sensations while they're there. So, trying to avoid potentially face massage, try to avoid having them face down and having compressions of their face into the headrest might be a big thing to consider. But otherwise, keeping it simple and short there. Trigeminal nerve, fifth cranial nerve, right? Pain around the face because of that. All right, so our endocrine system. So our nervous system and our endocrine system are pretty much the two main systems responsible for regulating all of the processes in the body. Now, granted, every bodily system is important for us to function, right? But the hormones from the endocrine system and the neural impulses from the nervous system cause everything to change or happen in the body, even though, some, organs and viscera still produce their own particular hormones, but whatever. So what exactly does the endocrine system do? Well, it produces and secretes hormones, right? Our endocrine system is also known as our glandular system. And well, our glands produce those hormones. So those hormones, there's lots of different hormones, right? And so pretty much all of the functions of the endocrine system are related to what those hormones are doing. Well, we have tons of hormones that regulate our metabolism, the growth and development of the body, absorbing of nutrients, right? And just maintaining metabolism in general as well, right? So some of our, one of the biggest examples is our growth hormone, right? Stress adaptation, right? So there's an interplay between the nervous system, specifically the sympathetic, right? The sympathetic division of the nervous system has a direct neural link to, well, our adrenal glands, right? And can promote stress adaptation, right? Regulating, the adrenal functions in the states of trauma, stress, anything like that, right? Is there. Chemical composition and fluid balance, right? We do, of course, regulate or speak to the kidneys. The kidneys themselves also produce hormones that also help to regulate pH balance and fluid volume of the body, as well as the heart does as well. Atrial diuretic hormone, atrionatritic diuretic hormone, something like that. And so, yes, we're definitely maintaining the composition of the fluids in the body, all that good stuff. Of course, right, anyone says we're hormonal, right? We always associate it to, being a young developing person, right? And so, of course, our glands, some of our glands are our reproductive glands, sexual glands, right? So testicles, ovaries, right? And so, of course, they regulate reproductive function and development. So our first condition of the endocrine system is diabetes. So diabetes is caused, well, no, okay. So first, before we say cause, there's two different types of diabetes, type 1 and type 2. So type 1 diabetes is typically you're usually born with it, or you develop it as a child. So type 1 diabetes is what we call, basically insulin dependent diabetics, right? So type 1 diabetics can't produce insulin on their own, and therefore they have to take it exogenously. Exogenously means, from outside of the body, right? So typically they have to monitor their sugar intake and, take insulin when necessary. Most people have so if you do have a type 1 diabetic, sometimes they have a thing that they have on their body that will monitor and apply insulin when needed. I'm pretty sure, I think they can take that off, so it might not be on them when you're performing the massage, but just in case it is, consider that it might be there. But other considerations, we'll wait for the full explanation. Anyways, so type 2 diabetics is, the result of developing diabetes later on in life. So we call this insulin resistant diabetes. So type 1 is insulin dependent, where they depend on insulin from an outside source, where type 2 is insulin resistant. So the fact that your body can produces insulin, but it doesn't respond to it, or doesn't produce enough insulin, and cannot regulate its metabolism in that regards. So type 2 diabetes, I know we often associate it to, just being overweight and having poor diet and lack of exercise, which, yes, all of those things could be contributing factors, and placing those into your life could help with type 2 diabetes. But there's plenty of healthy, normal, I know, as if they were abnormal if they weren't doing it, plenty of people who are healthy can develop type 2 diabetes as well in their life. And so it's just something that could potentially happen, right? Your body just becomes resistant to the insulin it produces. So what are our big considerations? Well, one, if we have a type 1 diabetic, then if they are on insulin and they do, let's say they took some insulin earlier before the massage, right? Well, did they maybe take too much? Now, granted, if they've been a diabetic for a long time, they more than likely know their limits, but sometimes taking too much insulin can cause insulin shock, which causes hypoglycemia, which hypoglycemia is low blood sugar in the body. And so hypoglycemia is more deadly than hyperglycemia. So what are the signs and symptoms of hypoglycemia? So hypoglycemia, what you would basically, they're almost like they're drunk, right? The slurred speech, pale, cold, clammy, really uncognizant, right? They might just be all over the place and just talking gibberish, right? And so on and so forth. So should you happen to encounter someone who is in insulin shock or has hypoglycemia, they more than likely have on them, if they are diabetic, they more than likely have on them some sort of a sugar tablet or something like that. I think they call them like Necco wafers or something, I think is what most people commonly take. Now, granted, I'm careful of like giving something to someone, but providing it for them, they can take it themselves and they can chew on it, suck on it, right? Maybe if you have a sugary juice or something that they can sip on, or a Coke or something in the lobby they can sip on, right? Slowly sipping on that so that they can slowly raise their blood sugar levels, and as soon as their blood sugar levels are more normalized and they're starting to come back to consciousness kind of, then you can proceed from there. How are they feeling? Do they want to continue the massage? Whatever. Probably best thing, maybe just postpone it, right? It's kind of awkward, right? They probably lost a lot of time, just reschedule, whatever. And the same thing could happen, potentially for type 2 diabetics if they do have to take insulin. But yeah, especially because massage has been shown to lower blood glucose levels by promoting the release of insulin from the pancreas itself. So if they did take their insulin and we perform a massage, right, it could have an added effect to that as well. Other things to consider about diabetes would be, let's say you did have, like, say, the type 2 diabetic who is just very overweight, everything like that. One, if they have that overweight problem, circulation is a big issue. And so I'm pretty sure we've all seen those, really hefty people, the diabetic people, and their just legs are just swollen red, and it just looks crazy and just is gnarly looking, right? Well, the circulation isn't as good, isn't as proper in the area. So, being very careful around the lower legs is a big thing. It may be necessary just to avoid the massage there entirely, but if you are trained in circulation massage, lymphatic drainage, then maybe working on that area is usually pretty good. Another thing to consider is that with the poor circulation, as well as what's called diabetic neuropathy, which is where you have the numbness or loss of sensation in the hands, and especially the feet, right? They might not feel their feet much, right? And so another problem with diabetics sometimes too is that they could step on something, right? And it could cause an injury to the foot and they wouldn't even notice, right? And so a big problem is with that injury to the foot that it goes unnoticed. Well, without circulation in the area, it doesn't heal as properly and it slowly becomes necrotic. And eventually, right, we all know that diabetics is in severe cases, right, they have to have amputations, right? And so it could start from the toes to the foot to the knee to the leg, everything, right? Eventually up the chain. So, if you do notice that they have cuts or anything on their foot, let them know, especially, they might not, right? They could even have things stuck in their foot, like a Lego, nail, screw, thumbtack, who knows, whatever, right? Or they just scrape their foot, right? And they didn't know, and it just doesn't heal properly. So, make sure that they become aware of that. But if their foot does seem unscathed and rather healthy, then you could also just light stimulation and light
progress.
Light stimulation and light massage could also bring nerve supply and awareness from the nervous system towards that leg. And so usually diabetics enjoy a little bit of a foot massage, just make sure that foot's healthy enough to do so. A goiter, I don't know, it's just really on the the list of pathologies there. You're really never going to ever see a goiter. Goiters are really only seen in like very underdeveloped countries, or people who just don't have access to food regularly, but anyways, it's an iodine deficiency, and so iodine is a very important mineral that for your thyroid gland. And so what happens when the thyroid doesn't receive iodine, it can't function properly, it swells, whatever. But anyways, causes that big mass of the around the thyroid gland itself, which is why we have iodinized salt, right? Because there was a time where iodine deficiency was a thing, right? So I know, and everyone's like, oh well, I only eat the pink Himalayan salt. Get a little bit of that iodine in the diet, especially if you don't eat seafood, right? I mean, that's usually your biggest sources, right? But anyways, goiters. Hashimoto's disease. Again, this is an autoimmune disorder, and so autoimmune disorder specifically attacking your thyroid gland. And so, your thyroid gland helps to regulate a lot of things in the body, and so you could have all these types of symptoms listed on this particular picture, right? So one, your thyroid, it helps to regulate metabolism to an extent. It helps to regulate the uptake of nutrients in the body in some regards, right? Especially when we're talking about the stimulating osteoblastic activity between the parathyroids and thyroid, right? So a big thing to consider with Hashimoto's disease, right? Some of the instances would be lethargy, or just weakness of the body itself, right? Bloodborne disorders as well, or not bloodborne disorders, but blood conditions such as like anemia listed as well, could be present, right? And so just being not so vigorous with your massage for Hashimoto's. All right, our next system is the respiratory system. So our respiratory system, right, is our lungs, breathing, right? So what do we do with our respiratory system? Why do we have a respiratory system? Well, one, the primary function of the respiratory system is to exchange gases, right? So pretty much the main gases we're exchanging are carbon dioxide and oxygen, right? So of course we're going to breathe in, oxygen-rich air to exchange with carbon dioxide-rich blood, right? To exchange the carbon dioxide in our blood with that oxygen in the air we just breathed in. And then we're going to send that blood throughout the rest of the body so that every cell can trade out more carbon dioxide and oxygen, right? I mean, we need oxygen, and every cell needs to breathe oxygen and use oxygen for metabolic function and processes. So yes, the cell on your in your big toe needs to breathe, but your big toe can't go to the lungs, so we're just going to send it there via the cardiovascular system. So of course, if we take a deep breath in, well, we can smell things. So we do have specialized receptors in the nasal cavity that detect smell, aka olfaction. Also, well, what I've been doing this whole time, which is just talking and making sounds, right? Sound production is an important function as well. So as we escape air from the lungs and it passes through the larynx, where our vocal cords are located at, our vocal cords can create different vibrations and sounds by altering the air that as it passes through. And then, of course, maintaining homeostasis is the biggest thing, right? I mean, we can go a good long time without food. We can go about a month, right? Depending on how much, body fat you might have, you can probably go a little longer without food. You can go, upwards of a week without water in certain conditions. Go more than 5 minutes without oxygen, it's game over. After 5 minutes of complete oxygen deprivation of the body, brain mass starts to die. I mean, your brain actually uses about 20% of the oxygen that you do uptake into the body. Breathe. All right, so pretty much with all of our respiratory conditions, it's all about breathing, right? And so how is it going to be hard for clients to breathe when they have respiratory issues? Well, normal, healthy people, when they're face down in a headrest, get stuffy and can't breathe properly, right? I mean, it happens to the best of us, right? I hate it too, right? It happens to me all the time. We just, and then your client's like, give me a tissue. And it's like, well, this tissue is going to do nothing because there's no mucus that's causing your stopped up. It's literally just the sinuses that have now reached to the front of the face and they're putting pressure on the areas. But anyways, so our biggest thing is with respiratory issues, maybe we don't lay them face down. We keep them, propped up, keep their shoulders back so that the airways they're able to breathe as best as possible. So anyways, asthma, our first condition, is where the airways become narrowed, right? And so this causes shortness of breath and everything. So asthma can be caused. You usually develop it. Asthma can be caused because of smelling something, stress, or other things as well, other onsets. So with that, try to make sure that your rooms don't have particular smells that could cause asthmatic attacks. Make sure, again, consider the position of the clients. There's lots of studies that show that massage for people with asthma is very beneficial, mostly because of the relaxation effects that it really has. Another thing, if they really do have chronic asthma and they do have asthmatic attacks like that, they more than likely have an inhaler. I've had plenty of clients who had asthma and they just have inhalers on them all the time, and places that they normally frequently visit, like when I worked at the gym, people would leave their inhalers there, like a spare one, just so it was there, right? Common places that they go, especially if they know that they might potentially have an asthma attack there, right? So if they have an asthma attack and they need their inhaler, just hand it to them. The common cold. Well, we all know what the common cold is, right? It's a upper respiratory infection caused by a virus, right? So I guess, hopefully at best, reschedule them, but, any normal client who doesn't want to pay their reschedule fee, especially right before they go get their massage, right? They're going to go in sick as hell. So it's up to you, use your best decision and judgment whether you need to postpone the session. If they have like discharge, basically from the nose, snot, boogers, consider that. Make sure you're keeping everything extra sanitary should you proceed. And I don't know, just wear a mask. So it's not always, I know some questions out there will say that it's not always a condition where you cancel the massage, but you might have to. But use your best judgment in doing so. Bronchitis. So there's two types of bronchitis. There is pretty sure it's bacterial. A bacterial infection causes bronchitis, as well as you could just have inflammation of the bronchial passageways. Now, typically because of like irritation, usually like cold weather. So people up north in the cold weather can get bronchitis. So if they do have chronic bronchitis, that's usually non-bacterial, or it might be viral. I think it's bacterial though. Then, consider the positioning of the client. And then if it's really severe, maybe postponing if absolutely necessary. If it is contagious, again, consider postponing the massage as well. And again, it's the positioning of the client as well in general. Emphysema. So emphysema is damage to the passageways of the lungs, and specifically the little exchange sacs known as the alveoli. So this, usually happens because of smokers or people who, work in, the industrial industry and inhale certain things and so on and so forth, right? So this causes the inability to really to take up oxygen. So again, breathing is very difficult and labored. So consider the positioning of the client, and again, try to be maybe a little less vigorous with your massage as well. Hay fever. So I know we kind of mentioned allergies already. Well, hay fever is basically the explanation of allergies, right, to the dust and dander, pollen, so on and so forth, right? So again, if they're stuffy and hard to breathe, consider the positioning of the client, and I guess differentiate. Well, is it a cold that's potentially contagious, or is it just allergies, right? Influenza, right? We all know about the flu. They tell you to get your shot, but whatever. I don't. I'm probably a terrible example. Cancel me. Whatever. But anyways, the flu. Right, we all know what that is. It's just the viral infection of the upper respiratory tract. Oop, go back. Oh crap! Just trying to click off the thing. There you go. So, yeah, very contagious, right? If they got the flu, definitely, postpone the massage, cancel the massage. Yeah, I guess we should put COVID up in here too, right? I should rewrite that for COVID, right? Yeah, same thing for COVID too. Drink your bleach, right? Trumpet. So pneumonia. Pneumonia, there's lots of different types of pneumonia as well. Usually they can be caused by viruses. In this case, it even says fungi, bacteria as well. And the pneumonia is pretty life-threatening. So if they have pneumonia or they're getting over pneumonia, probably best to really postpone the massage until they are a lot more stable. And then, even afterwards, again, just be, very relaxing with your massage, less vigorous, and again, position. Consider the position for your client. Sinusitis. So inflammation of the sinuses, as it said there. So there could be lots of different types or causes of sinusitis. It could be, just general irritation. It could be viral. It could be bacterial, right? Something gets into the mucous linings and then causes inflammation and fluid buildup. Again, consider the positioning of the client, and then if the sinusitis is infectious, then consider that did they have discharge, be extra sanitary. And it also says to avoid the lymphatic drainage. I believe I did see some studies on that it might promote the spreading of the infection. All right, and so we're into the cardiovascular system. A lot of these conditions are going to take some time to really go over. So I said this might be the last video, but it looks like it's going to be a part 4 To be continued, John Wick style. Let's go. Well, I think we're gonna stop there since it's getting kind of late and I don't want to take too much of this time. So let me go ahead and just open the floor to questions and we can cancel the recording. Hello. Amber? 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 Hello? Hello? Well, man, has anyone got questions? What's up? No one got questions? I just want to say thanks, which I appreciate it. It's all for you guys.
Thank you so much, Mr. Rob.
You're
Hopefully I
welcome.
can pass this final.
Yeah.
I think I need to reschedule.
Yeah, I want to see the comeback kid. I want to see you come back and pass it out.
Yeah, pass out.
Well, pass the test, not like fall out.
Oh, okay. Oh, okay. Thank you so much.
You're
I
welcome.
greatly appreciate you.
You're welcome.
Oh, I need to also, I know it don't got nothing to do with this, but I need to come to you. I don't know when, probably tomorrow. No, not tomorrow. Maybe tomorrow. When
I
can
got
I
a
be
few
scheduled?
appointments tomorrow, but what are you trying to
Okay.
like study with me? What's up?
Something.
Mm.
Yes. I don't know. Something. I need help.
I'll try. Do my best. But yeah, I can reach out and set something up. I'm kind of busy tomorrow with some other appointments, but I'll see if I can pencil you in. I mean, maybe throw out some times.
Okay, thank you.
You're welcome. Well, just gonna dip, I guess. Amber, do you hear me? Can you stop recording? Uh, Are you out there? I see you. All right, well, I'm going to leave. See you later. Sure, there's no other questions. All righty. Bye-bye.
Have a good one.
See you. You too.